Hi, I'm Dr. Gerald Evans. I'm the Medical Director of Infection Prevention and Control at Kingston Health Sciences Centre and Providence Care Hospital here in Kingston. As everyone knows, we've been through the last 3.5 years with a pandemic. And recently, the WHO announced that we are out of the public health emergency phase of that pandemic and transitioning into what will eventually be the end of the pandemic. However, here at the hospitals, we continue to be concerned about our patients and our staff, just simply because we know the consequences of COVID-19 infection can be severe for some individuals. We've already begun some plans on de-escalation, and that was informed by the fact that we had a reduction in a number of the parameters that we follow out in the community that showed that the risk was reduced. And more recently, we've seen some substantial reduction in those parameters that we follow, including test positivity, which tell us now that the risk of transmission out in the community, and therefore within our hospital, is actually a lot less. As a consequence, we're now moving to a further part of our de-escalation plan, and that involves changes that will reduce the mandatory requirement for physical distancing, as well as masking for most areas of the hospital, except those areas that serve a vulnerable population and or where we might expect transmission to occur, such as the emergency department or the urgent care clinic. So what we're asking now is to get your opinion and your feelings about how these changes are going to impact you, whether as a staff person, as a patient, or as a community member. And we'd like you to really give us that information, so that'll help to inform how we move forward with these plans for further de-escalation. This is going to be a return now to somewhat normal conditions, which we saw before the pandemic, but we also recognize that some individuals may be quite anxious about these changes, and we'd like to know how those changes might impact you and other things that maybe we have not yet considered. So in answering the question, is there anything else we should consider with this change? We are inviting you to go to our website and to give us that information after reading through perhaps some more details of what our current plan is as we move to the next phase of our de-escalation plan here at the hospital. Again, this is an important step, and we want to make sure that we have everyone's feelings and opinions about this so those can be considered in a respectful way.